Hello and welcome to Health Professional Radio today. I'm your host, Neil Howard. Thank you so much for joining us. There are a lot of places that you could be on the internet. You chose to be with us, and for that, we're truly grateful. There is a lot of talk in the mainstream media about diseases and maladies and defects, cancer, HIV, COPD. There's so much that we hear about diseases, and yet there's so little mentioned about sickle cell anemia. Our guest in studio today is Dr. Nina Anderson, President and CEO of Tova Community Health. She's focused on research into sickle cell, and she's also an activist in an attempt to raise awareness and funding for continued research of this disease. How are you doing today, Dr. Anderson?
I'm great.
Thank you so much for returning. When we were here in another segment, we talked a little bit about what sickle cell was, how it affected the body. We discussed some of the ways that the disease is identified in both infants and in adults. And we also discussed the effort to test all infants now at birth for this disease. Did you begin your medical career focused on sickle cell, or is this something that you decided to specialize in way down the line in your career? What prompted you to become interested in sickle cell anemia specifically?
So first, I just wanted to let your audience know that my background is I am a nurse, and I received my bachelor's and my master's from University of Delaware, and I received my doctorate in nursing practice from Thomas Jefferson University in Philadelphia, Pennsylvania. But I started my career in 1998, and I was working for a children's hospital that had a hematology oncology ward. And I noticed seeing the little babies and children coming in for fever admissions and sickle cell pain crisis. And wanted to learn more about it. How do we take care of these babies and these families in the most compassionate manner? And it was something that sort of sparked my interest just working with the children and the families at the children's hospital. And once I finished my master's degree, there was an opening for a position at the Marian Anderson Comprehensive Sickle Cell Center, which is located in Philadelphia. And at that time, we were one of 10 centers that received funding by the National Institute of Health. And so I was so excited to have been offered the job, and I was able to work at a center that took care of close to 500 children in the tri-state area.
Now, is your research aimed exclusively at childhood sickle cell, or does your practice handle anyone who has the disease or who wants to find out more about the disease?
So my research looks at healthcare utilization and cost of care for adults with sickle cell anemia. One of the things that I found in my journey and in the work that I'm doing here in the state of Delaware is that children have a comprehensive sickle cell center at the Children's Hospital where they receive very comprehensive care, very family-centered care by a team of hematologists, social workers, nurse, psychologists. And once they turn 18 to 21, they're transitioned out of that pediatric program into the adult world. And unfortunately, adult care for people living with sickle cell is so much different, and unfortunately receives 4 times less funding for research and clinical care than do children who have sickle cell disease anemia. So my research looked at cost of care for adults living with sickle cell in the state of Delaware and how much was spent on their hospitalizations. And I looked at data from over 3 years and was able to show that just for 96 adults living with sickle cell, just alone their hospitalizations cost the state close to $3 million.
$3 million.
That's correct.
So basically, like a fight against any other disease, there is a lot of money that's required to continue research. And once, you're in the research, you're coming up with different ways, newer and better ways to care for these patients. And those innovations cost money. Now, we see a lot of celebrities and athletes who have different diseases. Maybe they have it, or their aunt is living with it, or a parent, and they're often asking for donations or offering their services as a celebrity to raise awareness. In the case of sickle cell, are there any prominent people out there, athletes or celebrities, who either live with the disease or are helping you with your efforts to raise awareness?
So, I want to say that Junior Spates from the Steve Harvey Morning Show is the Sickle Cell Disease Association ambassador.
Okay.
He lives with sickle cell disease anemia. T-Boz from TLC, I don't know if you remember that group, also
sure do.
has sickle cell. But I wanted to tell your audience that the oldest known person who actually died of complications of sickle cell disease was actually Egyptian pharaoh King Tut.
King Tut died of
Yes.
sickle cell.
Complications of sickle cell disease anemia.
I had no idea, never even considered it. And I guess being in that region of the world, he must have been, or his parents must have, as you said in another segment, survived malaria, yeah?
Yes. Mm-hmm.
Well, that's something new. Learn something new each and every day.
Yes.
And, now, as the ambassador, Stand and Deliver tour, he was on that tour in Philadelphia,
Mm-hmm.
and you were invited, yeah?
Yes, a couple people from my committee and myself were actually invited, and want to thank Junior Spates and his team for having that in Philadelphia, Pennsylvania. But I believe it was a worldwide tour. Invited us to his comedy show, which was just well attended and was a fantastic event. But Junior Spates is really active and doing great things for the Sickle Cell Disease Association, and also increasing awareness about the disease. But again, we need more people who have the ability to bring it to the attention on a greater stage to do that. But unfortunately, at this point, we don't have a bigger name than Junior, but he's done a fantastic job. We need more people. We need more help.
With Junior Spates and as you mentioned, T-Boz of TLC offering some of their celebrity to raise funds for research. I think back to when AIDS first hit the scene, or the Ebola virus, or anything like that. Your experience with the media, I'm sure you've learned that a certain spin or a certain twist on a story can make or break an awareness movement. What are some of the barriers that you've come across in trying to raise awareness for sickle cell?
I would say is that the marketing exposure is a huge barrier, so that if you do have someone who's interested in championing that, they would probably receive more financial benefit from working with another organization, like a cancer organization or diabetes or hypertension, one of those chronic diseases that has more monies and funds attached to it and resources. Unfortunately for sickle cell, we just don't have those type of resources available on a statewide basis or a national level to do that. And thus, other chronic conditions or cancer, there's so much more money and resources associated with it, and it's very difficult to get people involved.
Now, obviously, people living with sickle cell being on the low end as far as the effects of lack of funding, I guess the next person up would be their healthcare provider. If you're having so much trouble raising funds and awareness for continued research at that level, what about the physicians, the healthcare providers that are trying their best to help those that are living with sickle cell, or to help those that want to find out how to take care of someone else? What are some of their barriers?
So the barriers are the training and the lack thereof, even at a medical school level. Fortunately, the fellows at where I used to train at Thomas Jefferson University, and that I'm sure that sentiment is shared around the country, is that there's not enough return on investment to subspecialize in taking care of people with sickle cell disease. And so they will go into other areas of blood cancers where they can make more money. And unfortunately, if you're coming out of medical school with, $100,000 plus in debt,
Absolutely.
you're going to want to work in an area where you can make a decent living. But unfortunately, to do with this population being, at least in the state of Delaware, 90% of adults with sickle cell are publicly insured, the reimbursement rates are so low, it makes it very difficult for a healthcare provider to want to subspecialize in this area.
I guess sickle cell isn't as glamorous as the others that you mentioned, the cancer or the Alzheimer's or things of that nature. When it comes to your experience, what do you feel is the number one best way to raise awareness? Say, for just one individual, what is that one thing that you would say or try to point out to tick a light in their brain to offer some help?
There's so many things I would say, but I would say if from a strategic perspective, I would say start by training nurses, social workers, internal medicine doctors, hematologists, oncologists, on how to take care of people living with sickle cell, and especially adults, making sure that each patient has an individualized care plan and that they receive personalized pain management when they go to the emergency room or to the hospital, and to really discuss these implicit biases honestly, that healthcare providers are the people on the front line that are taking care of them, in an effort to really improve the care when it comes to them being treated for sickle cell pain crisis, which most of the times that's what brings at least adults to the hospital. So I would say put the money into training.
As we wrap up, I'd like to ask how we can get in touch with you and get some answers to some of our questions.
So you can go to my website, which is www.tovacommunityhealth.org. You could also reach me on Facebook, Twitter, or you can also email me at contact@tovacommunityhealth.org.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. We've been speaking in studio today with returning guest Dr. Nina Anderson, specializing in sickle cell anemia as an activist and also as a healthcare provider and as president and CEO of Tova Community Health Incorporated. We've been here talking about some of the barriers associated with raising funds and raising awareness for the continued research of this often very little talked about disease, and also how we can contact Dr. Anderson and get some answers to some of the questions that we may have about sickle cell. It's been great talking with you again today, Dr. Anderson.
Thank you.
Thank you so much. Thank you so much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.